So these are the differential diagnoses: lipoma, fibroma, soft tissue abscesses, oral hemangioma and oral lymphangioma. The lipoma is usually yellowish in color, whereas the mucosal is usually bluish to translucent in color. So this way it can be easily distinguished. The fibroma is usually hard in firm in consistency, and is usually seen in the older individuals, that is in the 4th decades, and it is mostly seen in the buccal mucosa fibroma. The soft tissue abscesses are usually painful, whereas the mucosal is not painful, it is a painless swelling, as well as we can palpate the lymph nodes in cases of these abscesses. In cases of oral hemangioma, it is blue in color, but it blanches on digital pressure. Thus we can distinguish. And cases of oral lymphangioma, the most common site is the anterior dorsum of the tongue or the border of the tongue, the most common site of the oral lymphangioma. Now, this was the investigation that we did. The total RBC count was 4.5 millions. The total WBC was 10,000 mmQ. The bleeding time was 4 minutes. The clotting time was 5 minutes, and the hemoglobin reads 12 gram%. Everything was under the range, within the range. We did the histopathological examination. It revealed the formation of well circumscribed cyst like spaces surrounded by granulation tissue and the presence of mucinophages in the collapsed wall of the granulation tissue, suggestive of mucus extravasation cyst. And the final diagnosis that was drawn was mucosal. The treatment plan was, there was no immediate treatment required, but we planned the treatment as surgical excision and enucleation of the cyst. The treatment that was done was phase 1 therapy was not required, which includes the root planning and the scaling. Phase 2 therapy consists of a surgical excision of the lesion under local anesthesia. The patient was explained about the procedure and informed consent was obtained. Local anesthesia was not infiltrated directly into the lesion because it might compromise the biopsy procedure. The lip was then everted with digital pressure to increase the prominence of the swelling. First, a semicircular incision was made around the lesion to obtain a proper biopsy sample and to decrease the extent of the mucosal tissue loss, decrease the incidence of the scars that helps spilling the cystic content, which could be responsible for recurrences of the swelling. The dissection was performed, separating the lesion and associated minor salivary glands. Now, to reduce the chances of the recurrences, the lesion was removed down to the muscle layer. All the surrounding glandular acini were excised, and damage to the adjacent gland and the duct were avoided while placing the suture. The surgical site was then thoroughly irrigated, and then the wound margins were approximated and sutured with silk sutures. The specimen was then sent for the histopathological examination. The post-operative instructions were given and the analgesics were prescribed, and patient was recalled after 1 week for the removal of the sutures, and a satisfactory wound healing was seen after then. These were the surgical photos, images. The complete removal of the cyst was done, avoiding the margins, and all the cystic tissues were removed. Now, for the maintenance phase, proper oral hygiene instruction was given to the patient, and patient was recalled after 7 days of surgery. The prognosis was found to be good. These are the post-operative images. This is the follow-up after 5 days, and after 10 days the lesion was healed. Now come to the discussion. It is a term used to describe the swelling caused by pooling of the saliva at the site of the injured minor salivary gland. It is also known as mucus extravasation phenomenon or mucus escape reaction. It is not a true cyst, it lacks an epithelial lining. Now, the exact etiopathogenesis is trauma, and it is caused by the laceration of a minor salivary gland duct by trauma, resulting in extravasation of the mucus into the connective tissue. There is an accumulation of mucus in the connective tissue, and with the continuous pooling of saliva, a clearly demarcated cavity develops which has no epithelial lining. Now there are two types of mucosil. One is the extravasation and the other one is the retention. Now the extravasation types results from a broken salivary gland duct, usually the minor one, and consequent spillage into the soft tissue around this gland, and the retention types appears due to the decrease or absence of glandular secretion produced by the blockage of the salivary gland ducts. Now the clinical features, the age and the sex, usually it occurs in the younger patients. There is no specific sex predilection. Site is very common and frequent in the inner aspect of the lower lip and may also be seen in the palate, cheek, tongue and floor of the mouth. The symptoms are, patient may complain of painless swelling which is frequently recurrent. Swelling may suddenly develop at meals time or may drain simultaneously at intervals, and the size is almost minimum is 1 to 2 or 5 to 10. So the range is 1 to 10 millimeter in diameter. The appearance is, it is a bluish mass which is fluctuant, soft, nodular, and it is a dome shaped elevation. The consistency is soft or hard depending upon the tension in the fluid. The aspiration gives out a sticky, viscous, clear fluid, and the recurrence rate is quite high. Patient may give history of recurrent swelling which ruptures and reappear again after some time. Now we can diagnose this clinically and laboratory. Clinically, we see a dome-shaped swelling which is usually present most commonly in the lower lip, and in the laboratory diagnosis or in the biopsy we can see vacuolated macrophages which are also known as muciphage. The differential diagnosis, again we can see some more differential diagnosis. A vascular lesion and superficial non-keratin cyst, and we can differentiate it by aspiration, because here we can get a thin liquid aspiration we get here. In early mucoepidermoid tumor and adenocarcinoma, usually there is an induration present, but here there is no induration present. The management can be done with the help of cryosurgery or surgical excision. Like here, in here we did surgical excision. Thank you.